Hey everyone, I'm Tanvi Kumawat, physical therapist, and today I'm going to talk about knee pain assessment. Knee pain can occur due to various conditions like osteoarthritis, rheumatoid arthritis, chondromalacia patelli, also known as patellofemoral syndrome. It is a condition which can occur due to repetitive movement of knee, which is most common in runners or jumpers. And osteoarthritis is a condition which is most common in women in old age. Other conditions like meniscal tear, medial meniscal injury or lateral meniscal injury, ligament injury like lateral collateral ligament injury or medial collateral ligament injury, or due to anterior cruciate ligament injury or posterior cruciate ligament injury, and some other conditions like bursitis. And apart from it, a condition like stress fracture of tibia. So these are some conditions or causes due to which knee pain can occur. So in today's video we are going to discuss about the assessment of all of these conditions. There are certain tests for all of these conditions. So let's get started. So the first test is anterior drawer test. In this test, what we have to do is we have to stabilize the distal part of the femur, and through our other hand, we have to move the tibia and fibula forwards in the anterior direction. So this is the anterior drawer test for ACL. We will compare the laxity of the ACL ligament. We'll compare it with the other leg. We can do another test for it also, that is Lachman test. So another test for ACL is Lachman test. In this test, what the therapist has to do is place the thigh of the therapist for the support below the thigh of the patient, and then stabilize it with the one hand, and with the help of another hand you can move the proximal part of the tibia and fibula anteriorly in the anterior direction. Remember, there will be knee flexion of 20 to 30 degree range. So now let's talk about the another test. Now the other test is posterior drawer test for PCL, posterior cruciate ligament. In this test, what we have to do is we have to place one hand on the distal femur and other hand on the proximal part of tibia and fibula. And what we have to do is we have to move the tibia and fibula posteriorly and compare the laxity with the other leg. If we find more laxity in the knee area, then it would be positive. So another test is for medial meniscal tear. To check medial meniscal tear, what we have to do is we have to place our proximal hand at the distal femur to stabilize the femur. Another hand will be at the heel. So what we have to do is we have to apply a compressive force from our distal hand, that is which is at heel. We have to apply a compressive force and then move it medially. It can also be done in the prone position by applying a compressive force. But remember, compression is must, because if we apply a destructive force, then it would be a test for lateral and medial collateral ligament, not for medial and lateral meniscal tear. Remember that. If the patient feel any pain, then it would be positive. The vice versa for lateral meniscal tear, what we have to do is we have to apply a compressive force and move the calcaneum and tibia laterally. And if the patient feel over the lateral side, then it would be a positive test for lateral meniscal tear. So the next test is for medial collateral ligament. So medial collateral ligament is present over this side medially of the knee. For this test, what we have to do is we have to stabilize the distal part of the femur with one hand, and the other hand of the therapist would be at the distal part of the tibiofibular joint. What we have to do is we have to apply an outward force with our distal hand and an inward force medially with our proximal hand. If there will be any laxity or tenderness, then it will be the positive test. Now, another test is for lateral collateral ligament. In this, what we have to do is we have to maintain the same position of our hands, and what we have to do is just the vice versa of medial collateral ligament injury. That is, with the distal hand, what we have to do is we have to apply a medial force, inward force, and with our proximal hand we have to apply an outward force. So in this case, if there will be any tenderness or laxity in the knee area, in the lateral side, then it will be the positive sign for it. So another test is for osteoarthritis. For osteoarthritis, what we have to do is we have to check for the edema. What we have to do is we have to apply a glide from lower to upward direction, in lower to upward direction like this, and with the palm apply from upward. You will find an edematous fluid over this area. The test will be positive, but in this condition no such visible fluid, so this is a negative test for OA. For bursitis, the patient will feel painful over this area medially and over this area. If the patient feel pain over this area, then it might be due to prepatellar bursitis, and if the patient feel pain over this area, then it might be due to pes inserens bursitis. This is the palpation test. Clarke's test is for patellofemoral syndrome. We have to ask the patient to contract the quads, and we have to apply some resistance over the superior part of the patella. Contract the quads. If the patient feel any pain over this part, anterior part, then it would be a positive test for patellofemoral syndrome or chondromalacia patellae.